The burden of neurological disease has been studied in a worldwide study based on very solid data from an institute in Seattle, USA. What EAN has done is to collect the data for Europe based on their database. And from there we know that we have in our area, in WHO Europe, 905 million people. The most important number is that we have 435 million diagnoses, which means we have almost half of the numbers of diagnoses that we have inhabitants. This does not transfer directly into patients because people can have more diagnoses than one. But we are in hundreds of millions of diagnoses, and just for a rule of thumb purpose, we can say almost half of the European population has a neurologic disease. So this shows the problem. Certainly, then there are many very frequent diseases which frequently cause disability, and there are others which cause less disability, which does not mean that an individual patient is suffering less or more. It's just the way how the economists are ranking disabilities. And among those who create most of the disabilities at young age is headache. And among those with higher age, it's stroke and in particular Alzheimer's disease. And at a little bit later age, Parkinson's disease comes into it and has a major role. The younger patients often also have multiple sclerosis. And then the many neurological diseases that cannot be listed because there are more than 200 neurological diseases. And some, if you include the so-called rare diseases, this goes into the thousands of diseases. But nevertheless, there are 6 or 7 diseases which are very frequent and which show this kind of distribution and disability. Well, we are just beginning to understand a little bit the kind of disparities that we have in Europe. We know, for example, that for stroke, the prevalence of stroke is higher in the Eastern European countries than in the Western European countries. Also, disability due to stroke is higher in the East than in the West. Fortunately, what we can see from the numbers, in all countries you have decreasing numbers of DALYs, so disability adjusted life years, which is the economic measure of disability. And that is decreasing for stroke, fortunately, and this tells you something about the treatment that neurology can offer. We do have disparities also with respect to neurologists, practicing neurologists, available resources for the treatment of neurological patients. That differs quite a lot, and it's not like this that in the East you have too few physicians and in the West you have plenty of physicians. By far not like this. So the physicians are only in some countries very short than in others, and the reasons for this are very different. In some countries, neurologists didn't play a major role in taking care for stroke, for example, or for other diseases. And so this culture has not developed in this country. And these are all things which are now going to be rectified. We see this, that countries that have low numbers of neurologists are increasing them, and that's all a good development.